Hey guys, today we have Rachel in the clinic and she's come in with a cervical disc bulge. So she's been getting a lot of pain in her neck, down into the shoulder, to the back of the shoulder blade here, and even now starting to go into the arm, down the forearm, and sort of getting a little bit of numbness down here. That's telling me that that disc bulge is now starting to impinge on the nerve. So what we're going to do today is we're going to treat her neck, try to decompress some of these structures. But as I do that, I want to run you guys through some of what this injury is about, how it's developed, and things you can do to get on top of it yourself. So the major thing that we can do to see how this has come about on Rachel, and even yourselves at home, a quick test you can do to see is your neck pain coming from a disc injury, is you get the patient just to sort of flex their head just subtly, and then we put a compression load straight down like this. Only gentle, just sort of pushing down. I'm not going to do it to Rachel today because I know that's going to create a massive zinger down her arm and she's going to hate me. So for her, we're just going to get straight into the treatment. So the first muscle we're going to treat today is our traps, because that's a huge player in these injuries and it's just going to lock down in response to what's happening deeper in the neck. So Rachel, we're going to get in some active release technique. We're going to go from here and you're going to take that arm down and across like that as I work into that muscle, okay? Hold there for me. And off you go. Great. Coming back up. And again. So one of the major things that lead to this injury is sort of chronic bad postures. Often I'll see this with desk workers. Rachel is a receptionist, so she's spending a lot of hours at the computer and has admitted previously that, sometimes the posture's not the best. And what happens is that sustained forward head posture, it actually puts a lot of pressure at the back of the disc, and over time you get micro trauma to the disc and eventually it sort of wears out, and the inner part of the disc, which is it's almost like a toothpaste consistency, that'll protrude out, and that's when you get the disc protrusion and the pressure on that nerve. So the next muscle we're going to work on here, again a big player with that compressive load through the spine, is called the scalenes. So for this one, just some downward traction on the muscle and very gently taking that neck away. Good. So since we know forward head postures can really be the primary issue for this injury, we've got to sort of think about things that we can do to deload that disc. And one of the best things is sort of putting the neck into an extended position. And so that'll deload, the posterior part of the disc and sort of allow the contents of the disc to shift forward. And I'll sort of show you a trick that you can do at the end of this video to help at home. So the next muscle I want to work on is called the levator scapula, and it runs from the top of the shoulder blade coming up to the top of the skull here, or the bottom of the skull there. So Rachel, for this one, we're going to start here in this position, and you're going to stretch that hand down between the knees and lower the shoulder. And as you do that, you're going to look down and away just to stretch that muscle as I work into that. Go for it. Perfect. How's that feeling?
Yeah, good.
Good. Bring it back up and down again. Perfect. Coming back and again. Let's do one more. So other symptoms that can really indicate that you guys have had a disc injury is things like coughing and sneezing actually hurts this too. That's a real big player because that increased intra-abdominal pressure and the squeeze will actually irritate those symptoms too. Now, Rachel, let's get you laying down on your back and actually get into the neck itself a little bit more. All right. So we touched on the scalenes before, but I find this position here, we can get more into the front of the scalenes. And this is the part of the muscle that really gets jacked up with that poor posture. So you just relax your neck. I'll take that across. And that's okay, that's not giving you any nerve pain or anything like that. That's good, great. So I'd say this is probably one of the most important muscles that needs to be loosened up when fixing your disc injury. And then just in front of it here, you can sort of see that sticking out there. It's quite spasmed up. That's the sternocleidomastoid, or the SCM. Again, huge postural player in the development of cervical disc bulge. So we've got to take the pressure off that one as well. One more pass. Great. So then once that disc really gets irritated and everything sort of spasms and contracts like this, one of the sort of muscles that just continually irritates that disc because of that compression are the ones that sort of make up the cervical extensors running up the side of the spine. So that's what we're going to work on next for Rachel. So for this, I sort of take the traction up the neck, maintain that pressure as we sort of stretch the muscle as well. Now, mind you, as I do this, like I said, flexion can be quite irritating for the neck. So I'm also mindful of what she's doing with her chin. I don't want it to tuck too much to make that segmental flexion, because that could piss off the disc a little bit. But we just want to be specific to that point where my hand is, so we can stretch the muscle while not compressing the disc. So when you have a disc bulge as well, it's almost guaranteed that you're going to start suffering from tension type headaches due to all that spasm. It comes right up into these suboccipital muscles here. So that's the next tissue we're going to work in. So I like to stretch it laterally to the side there and then take it through its range too. So being a sort of injury that, you know, its risk factor in its development is posture related, things that you can do to help speed up your recovery or even prevent this injury happening in the first place is working on your posture. And so your shoulder mobility is a huge one. The chest muscles, your pecs through here, that's what's going to sort of draw your shoulder into a rounded position, sort of make your head travel forward. Then also working on the thoracic spine, so that part of the spine between the shoulder blades, and mobilizing it into extension with exercises like wall angels that you could look up as well to see how they're performed, are really, really good in preventing this injury. All right, one more pass there. Okay, so now that we've sort of taken the pressure off with some of those muscle releases, the next step is to get a little bit deeper with some dry needling, but we're going to go beyond that as well. We're going to do some electroacupuncture, because what that's going to do is it's going to change the sensitivity of the nerves so that she's not feeling such aggressive pain all the time, as well as it will train the body to go, it's not too bad, and allow those muscles just to relax a little bit quicker. Okay, so Rachel, let's get you laying face down now. All right, so like I mentioned, these sort of muscles, the cervical extensors, these have been a huge player. So what we're going to do is pop the needles in there, and that's going to go deep right down to the joint where it can really affect the disc there and decrease the inflammatory response. So these ones can be a little bit more sensitive. We're going to do 4 in the neck. And Rachel's being very tough. we'll go one in each trap as well. Good, one there. Nice little twitch. And now let's hook it up to the electroacupuncture. So when I do this, you're basically running a current from one needle to the other, and that'll sort of make the muscle just twitch a little bit. It's not painful or uncomfortable for the patient. I like to use it in two sort of settings. If there's nerve pain, I find it really effective, or if it's swollen, which I would say there's some swelling deep around that joint for this too. So it's sort of working on those two fronts. So Rachel, what we're going to do is we're going to slowly turn this up. You just let me know when you feel that ticking sensation in the neck, okay? And what you should see on camera is a little twitch once that sort of kicks in. Rachel will let it, you can feel it? Just a little bit there? Is it painful? No. Are you okay? So you can see the twitch there, but it's just a little bit uncomfortable for Rachel, so we'll turn it down just a touch. And each disc and each patient is different, so you're going to find that the sensitivity is varied. So some days patients can tolerate a really big, forceful twitch. Other days, like today, whereas Rachel's injury is quite acute, we're probably not going to load it up too much. Right now, we've just done the one channel with the green ones, but we're going to do the white one here as well. Rach, you tell me when you feel that second twitching sort of sensation. Got that there? Great. And that's just a little mild one. You probably see the needle just moving a touch. But what we're going to do is we're going to let that sit there for 10 minutes, so a little bit longer than I normally do, but to get the neural sort of calming effect, this one I like to sit for a bit. So that's been 10 minutes now, so we'll get these needles out for Rach. And the next step will be to adjust sort of the mid-back here. The reason we're doing that is to correct the thoracic extension restriction, like because of the postural overload that has sort of caused this injury in the first place. We won't adjust the neck because while she's got an acute disc injury, there is a risk that it could make it worse, and it's just not worth that risk reward. Some discs can tolerate it, but while it's angry like this, I'd hate for it to get worse for Rachel, and I'm sure she would hate that too. So let's go for the mid-back. Breath in and out. Beautiful. Now, the next step is what you're going to do at home to take the pressure off that disc while it's in this really acute state. And so we're going to actually just lie over a support for the neck to take all the weight off so the muscles don't get irritated holding the neck there, but it also puts it in that extended position, moving the contents of the disc anteriorly or forward so that that disc has no pressure on it and can actually heal. So Rachel, do you want to flip over for me? All those needles are out. And I'll sort of show how the placement of this is. It's really pretty straightforward. You just have that on your neck. Maybe come back a little bit so that your head actually hangs over it a little bit. And that's it there. And I would recommend for her to do this at least 3 times throughout the day for 5 to 10 minutes, just to take all the pressure off. That's going to decrease the inflammation in the neck, let the muscles calm down so they're not all spasmed all the time, because the more that spasms up, the more compressive load goes through the neck and the slower the rate of recovery is. Once we deload all these acute sort of tissues and she's sort of feeling better and she can actually move the neck and she's back at work, then the key to getting this so it doesn't become a chronic issue is retraining the deep neck stabilizers, which is like the core for the neck. But we'll get into those sort of exercises in another video. But for now, we'll leave it at that, and I'll see you guys next time.